Hello, I'm Dr. Kirk Huckel, founder of Princeton Center for Dental Aesthetics and Implants, located in beautiful downtown historic Princeton, New Jersey. Today I'd like to talk to you about sedation dentistry. We're one of the few offices in the state that actually offers sedation dentistry. There's a couple different types of sedation dentistry. One is IV sedation, and that's where, an IV, a needle is placed in the arm, the drugs are administered through the IV and produce the sedation. The other type is something called oral conscious sedation, which is the majority of the cases that we do here. Oral conscious sedation is really, we're giving you pills the night before and the morning of, usually on an empty stomach. They're sedative hypnotics. So it's a protocol that we use based on how much work you need, how long you need to be sedated. It's customized to that patient depending on many factors. You would need a companion to bring you in because you can't drive, obviously. You need to be brought home. There's two typical patients. One is somebody who's really anxious, who hasn't been to the dentist in 5, 10, 15, I even have one 20 years they haven't been to the dentist. So they've got a lot of anxiety. Oral conscious sedation gets them through that first visit. We get a lot of work done in a 4 or 5 hour period. And the nice thing about it is sedative hypnotics have an amnesic effect. So when they come back 2 weeks later, and I ask them, "Well, do you remember the appointment?" They really don't remember it. So there's no it leaves a positive feeling for them. The other type of patient that comes for care is maybe an executive or a very busy person who needs a lot of work, but they don't want to come in 10 or 15 times to restore their mouth if they have got a lot of work. They'd rather sit in the chair and be relaxed, and they can sit for 4 or 5 hours, and we can get all the work done in that visit, all the drilling, all the preparation work, extractions, root canals, and then they come back a couple weeks later for the insertion of the porcelain if that's what they need. I'd like to offer you a free consultation if you want to come in and talk about sedation dentistry. I'm happy to talk to you about it. Also, I'd invite you to go to our website and read about sedation. There's a lot of information on there. There's a blog that we have about sedation dentistry. So there's lots of information there. Call the office if you want to speak to me about it. I'll be happy to talk to you over the phone.